The World Health Organization suggests that 8 million people are killed by tobacco each year. And that is why the Department of Health has come out today in the Eastern Cape in Somerset East to raise awareness about the dangers of using tobacco products, especially if done so excessively. As you can see behind me, a number of people have decided to come out today and grace to this day and be a part of it, to listen to what the Department of Health has to say regarding this dangerous usage of tobacco. And also, if you can see on my left as well, there is a number of mobile clinics that have come out to screen people just to make sure that people are safe, and that despite the prevalence of using tobacco products in this area, they remain healthy and are able to fight any respiratory diseases that might be associated with the usage of tobacco. But right now we're going to speak to the Deputy Minister of Health. A very good afternoon to you, sir.
Good afternoon. Thank you very much, and thanks to your viewers. It was a decision of the minister. Any MEC who raised his or her hand, we were welcoming it, because this is like an important program, and you being the national broadcaster, we are going to actually deal with it in the whole of South Africa and the whole of Africa. It's a cold place, but it's nice to be here too. We are actually doing two in one. The first part is what we have alluded to, where we actually this morning listened to a researcher from South African Medical Research Council outlining, giving us results of what is called a global adult tobacco survey, where they're actually showing certain concerns regarding our community, our South Africans, where they are showing that up to 40% of people who also try to quit. So it means that people already started. Number two, they are also showing that 91% of smokers are acknowledging that this is a risky behavior. And what is interesting, the data is starting at about age 15, and that is what we call adult population. And one was wondering how many, if we were to go to primary schools, are children who are already beginning to experience this part. How many of us as parents are sending children to go and buy tobacco in areas where they are actually selling them? And this young person desperately says, this must be good that my father is asking to go and buy it, but he's also using it alone. Let me taste it, let me try it on the road going home. So we might be finding that unsuspecting, we are the answer, socializing our children to start by actually exposing them to these issues. So yes, it's a great concern. We are going to fight. It's the first time that South Africa is participating on this global survey, and therefore we are looking forward to analyzing these results and see what impact it will have. What are the strategies that we need to put in place in regards to actually fighting the tobacco use in our country.
And you add into the mix the issue of COVID-19. We know we're still in the middle of the pandemic, and yet you see the high prevalence of the use of tobacco, which is obviously one of the things that may cause respiratory problems. Can you just elaborate on that?
Of course, COVID-19, when we started seeing it, infection, it was really having a predilection for lungs. It was really giving those who were actually having chronic lung disease, some of it coming in from smoking too much, had a real serious pressure with COVID-19. So a combination of COVID-19 infection on a chest that is already compromised by smoking. Of course, smoking does not only limit itself to the chest, it affects the heart, it affects every other part of the body. Is actually a big problem, a big concern. So a combination of COVID-19 on a chest which is having a chronic lung disease is not a very good story.
And now lastly, Deputy Minister, obviously this is not the only area where there's a prevalence of tobacco product use. We have heard that the Western Cape and the Northern Cape also came forward. What is the way forward now further from this day in terms of continuing to raise awareness about the dangers of smoking?
As there are a couple of MECs in this meeting today, not only the MEC of the Eastern Cape and myself, the other MECs from other provinces, is to actually make it, because this is actually a national program, to say what do we do in our little corners. Firstly is to go and establish and also agree that we need to increase the awareness. I'm actually very heartened to hear that people who already smoke are already themselves, up to 92%, are indicating and agreeing that this is a risk behavior and therefore they need to be assisted. Close to 40% of people who are smoking said, I've looked around, I needed someone to assist me, I need to quit, where do I go? So that is a good start. So ourselves as families, as healthcare workers, you will be surprised that those who are advocating for tobacco use are telling us a story that yes, with tobacco use there is 12 billion rand revenue, which we don't dispute as a country, but they don't tell you that there's a 42 billion rand that we use to clean up the mess in the country, in families, in hospitals. Losing a 50-year-old South African because of the chronic lung disease, who started smoking at the age of 19, and that person is suddenly not available to support his family. That 50-year-old is suddenly not available to add value in terms of our investment, employment opportunities in the country. It's incredible. So when people tell you how much we will lose if we were to reduce or stop, it's very difficult to say people stop smoking, to reduce the impact of tobacco in our communities. They should also tell you how much, probably don't, because they don't know how much we use, what money we use to clean up the mess that has been created by tobacco use.
Thank you so much, Deputy Minister. Well, that was the Deputy Minister of Health saying that it is worrisome that a number of people up to this day still use tobacco, regardless of the warnings that have been put out there in terms of the dangers pertaining to the use of tobacco, and also saying that there is a worrisome number of school-going children that are being sent to buy tobaccos and as a result end up using them at an early age as well, and also emphasizing that it might seem like there's a lot of revenue that is being brought in from tobacco sales, but there's also more money that is being spent in terms of cleaning the mess that is being caused by the aftermath of continuing smoking this dangerous substance. But right now, from myself, Nqonji, and colleague Mcebisi Slengile, it's back to you in studio.